So we're with Sharon today. She's about a year out of upper eyelid surgery. We did upper eyelid blepharoplasty, removing the extra skin. We did upper eyelid ptosis repair to tighten the muscle to make the eyes more open. And we also just kind of stabilized the outer brow for her. We were not interested in kind of a full forehead brow lift, but we just wanted to give a little augmentation to the outer part of the brow. So tell us, what made you decide that you were interested in eyelid surgery?
It got to the point where if I read or watched TV, after 20-25 minutes, my eyes just closed. I wasn't sleepy or tired, just my eyelids were so heavy. I remembered my mother had the same thing. I started asking questions and I ended up getting referred to you, which by a wonderful doctor, so I knew you were going to be wonderful.
And tell us about the initial consultation. Is everything addressed during the initial consultation? Did you feel like you had more questions afterwards? What advice would you give someone before their eyelid consultation?
I must have been real pleased because my girlfriend came several months later and had the same thing done.
Okay.
I don't remember leaving with any questions, and I usually will ask it. I don't leave anywhere not satisfied.
Okay.
It's my way. So, no, I felt very comfortable and very on target that this is what I wanted.
So we had elected to do your surgery in the office rather than going to a hospital or a surgery center situation. So we did it just under local anesthesia. Tell us how that was for you.
Well, the initial shots, you feel them, but I always considered childbirth the worst pain, so it was nothing like that. And then I felt nothing. It was easy, it was very quick. I was surprised at how quick it is. Went home. I really felt fine. I took a nap that afternoon. The next day it was sort of a surprise to see how my face looked, but the black and blue is part of the healing.
Yes, a very good point. So I always tell my patients, you might think you're looking pretty good when you're leaving surgery, but the most of the swelling and the bruising is going to set in. So the day after surgery is where most of that is.
And it went away after a week or so. And
yeah.
I just found it very easy, very easy.
Were you nervous before surgery?
No.
Good.
No, like I said, I judge everything by childbirth. No.
And the recovery process, how did you feel like that was? Was it pretty much as expected? Did you feel like you had difficulty doing any of your daily activities, or?
No, I put off the gym for a few days. Not one, on your advice on how long to take off the gym, and two, didn't want to scare the other ladies there. But no, other than not going to the gym and being very careful about how I wash my hair and the shower, those kinds of things. While it healed, I was very particular about, didn't I have like eye patch or something?
So no patches, but we had the stitches in the incision line, so we don't want to pop the stitches or anything.
I was very cautious because I didn't want to mar it in any way.
Right.
But I thought it was pretty straightforward and healed pretty quickly.
How about, in front of friends and family? How did you feel seeing them? Did you have to hide out? Did you, what did they think about your recovery?
That would not be my way.
Okay.
No, they knew what I did, and either they love me for who I am or they don't. Yeah. So no. And like I said, the only reason I didn't go to the gym is it wouldn't have been good for the stitches.
Right. We don't want to pop your stitches. We don't want to get any setback.
If that had been okay, I would have went to the gym. If I was still working, I probably would have explained it to the students. But I was retired already.
Right.
But you don't want to scare the children.
Was there a point that you kind of had like a wow moment, like I can more lights coming in, I'm liking the way that I look?
Well, interesting enough, when I walked in the door after the surgery, my friend was there and she said, look at the size of your eyes. Yeah. And that's just when I didn't drive home, when my husband drove me home. And I gotta admit, I looked every day and sort of did this and looked at other pictures of me. So yeah, it made a huge difference.
Would you recommend doing the procedure, with us and at this facility and with our team?
Absolutely. For a multitude of reasons. One is it accomplished exactly what I wanted.
Good.
Reading, because I have eye issues and I'm legally blind, so I spend a lot of time reading on my iPad. And the inability to stay awake for more than or keep my eyes open for more than 20 minutes was a real hindrance into my day. Mm-hmm. So from a personal point of view, it was a miracle for me. And from how I was treated and stuff, everybody was wonderful. You were wonderful. The staff here was wonderful. People made it easy. And that's how I even want in life, is just make it easy. It could have been easier. It could have been more efficient or more professional.
Any advice to any other patients looking to consider eyelid surgery?
You take a look at the fact that depending on how you qualify, Medicare paid for it and paid for most of it. And I think for a lot of people my age, that would be something to consider, because I don't know what I'm talking about here, but I would think those kind of eyelid problems come with age.
Right, so definitely, genetics plays a role, but age, laxity, and it's really important that not every surgery is the same. Sometimes we're just dealing with, extra skin, and that may or may not qualify with insurance, and sometimes, like you, it might be a combination of something a little bit more cosmetic as well as something functional that qualifies for insurance.
And so I would say that's certainly worth researching. In my case, it worked out that way. Insurance works the way insurance works. I think that's a consideration for particularly people who are on Medicare, to at least investigate that and take a look at that. If you want to cosmetically, go for it. But in my case, the cosmetic was a bonus. It was just a real assistance to me, and it was something very important in my life.
We're glad you had a great experience, and thank you for your time.
You're welcome.